Welcome, everyone, to DEI After 5, the show that focuses on topics across diversity, equity, and inclusion with some of the brightest minds in the industry. Here's your hostess, inclusive culture curator, and coach, Sacha Thompson.
Hey everyone, and welcome to this week's episode of DEI After 5. So with the company name, The Equity Equation, I am always asked, what does equity mean? What does that look like? And so I really talk about that's where the hard work happens. It is how are we removing barriers or providing access for people that may or may not have access. And so today's episode, we are going to continue down this path of looking at access, looking with those opportunities. Removing barriers means, but in the healthcare industry, right? So we've heard quite a bit about health equity in the last few years, but many people don't even know what that is or what that looks like. And so today, my guest is Maria Flowers, who is a specialist in this area. So before I even go any further, Maria, welcome to the show.
Thank you so much, Sacha. It's a pleasure to be here.
So Maria, before we get into this any further, tell us a little bit about yourself and how you got into this work.
Sure. So I've been in the healthcare industry for over 20 years. I started off as a nuclear medicine technologist and just kind of moved my way up the ranks over the years. My most recent corporate experience was as a patient safety and risk manager in one of the largest healthcare corporations in the country. And I guess my inspiration or what kind of moved me into this area of health equity was some of the things I was seeing from a patient safety and risk perspective, and also on the employee side from a DEI perspective in healthcare organizations of, what was lacking. And then when I started my doctoral research, I just started kind of going down a rabbit trail trying to figure out, okay, why does this exist here? And what is the impact to the patient? And just kind of found a lot of things. And from there, my passion for health equity, it just grew legs. And I've been moving in that area ever since.
Wonderful. So can you define health equity for us? Because I think there's maybe some misconceptions about what it is or what it looks like. So if you could just kind of break that down so we make sure we're all on the same page.
Sure thing. So that's a difficult question to answer, I'll be honest, because depending on the person and the perspective, everyone is going to have a different definition of what equitable healthcare looks like. So I will give that disclaimer. But just in general, it is the sense that everyone, no matter, ability or privilege or lack thereof, is able to get the same access to quality and safe healthcare. I pause from going into outcomes. There's been some discussion about the disparity part of health equity, and a lot of the root causes that lend to the disparities that we see in health equity come from or stimulated from outside of the healthcare field. And so there's some, I wouldn't say controversy, but there's some conversation about, adding disparities in there. But it would be a parity of outcomes, at least equal to the population distribution of by race and ethnicity.
Yeah. So it really is about creating, opportunities, creating access, removing barriers, but specifically in the healthcare space for groups that tend to be more marginalized or don't have equal access, right? So what you just said made me think about the other factors that are involved, right? And as we do diversity, equity, and inclusion work, it's not just one or two things. There's always other factors. And so what are some of those other factors that could impact those outcomes? Once you say, okay, everyone has equal access, what are some of those additional challenges?
Sure. So yes, access is just one barrier, right? Systemic racism is really kind of that, you know, eyesore that we have in our country that limits us in a lot of other areas that impact our health. So yes, if everyone had equal access to care, there would still be that issue of systemic racism that impedes our ability to get the education that we need, which lends to literacy and health literacy that uh, can impact our ability to earn, our economic ability, the neighborhoods that we live in, whether there's a food desert or even a healthcare desert. All of those things go into and contribute to equal health care. And then things like implicit bias. All of us
Mhm.
have bias. It's just part of our makeup. I don't care if you say I don't see color or I don't feel, all of us have a bias. And so that tends to come into play as well.
Like as you were speaking, I was recalling I'd just seen a video of, oh gosh, Joy DeGreer, I believe is how you pronounce her last name, talking about just the historical things that took place and which caused racialized trauma for Black people. And one of those things was, I believe it was Thomas Jefferson, said, Black people do not grieve, like they don't feel grief. Um, and they don't feel, and there was this whole mindset of like, they don't feel pain. And so when I think of systemic racism, when I think about things that are systemic, it's that mindset that has continued, right, systemically through the medical field, right? When you think about the number of Black women that say that they weren't given pain medication during childbirth, because again, there's this mindset that, oh, she's not feeling pain, right? Or she has a high tolerance for pain. And so therefore it doesn't need or require medication in the same way. And so help me kind of understand, or how can we unpack, how do you, well, what's the best way for me to phrase this? Like, how do you start to unpack that? It's because it's so systemic. It's such a part. And when you think of how we try to look at the medical field as, this is kind of our saving grace, when you know that these inequities are kind of built in and there's some of these mindsets that are apart and some of the systemic challenges that are apart, it's overwhelming, right? And so how do you start to unravel or unpack that so that there is equity, or at least a semblance of equity in this space?
Oh, Sasha.
I know it was a loaded question.
That it's a lot to unpack there. Just not in your question, but just
Mm,
historically everything that is behind that. And I dug into that while I was doing my literature review of my dissertation. And it was really hard to emotionally to
mm,
process a lot of the things that I uncovered. But I'll say this: this country, unfortunately, was built upon a system of of racism and exploitation.
mhm,
It's not just that we were found, it's like, oh, let's do wrong to Black people. It was, let's find someone we can exploit for our
mhm,
gain. And unfortunately, um, these Africans from West Africa were able to be exploited. They were able to be overtaken, and they were exploited for a huge gain. And after the emancipation happened, a couple of things occurred. You had a large uh, population that was now, refugee, homeless. They didn't have anywhere to go.
yeah,
And then you also had, but then you had some people that were doing well. And you had some communities that were being established that were
mhm,
doing well. And when that political power, when it was shown that that exploitation was now, wait a minute, we may not be able to exploit these people anymore. We have to do something. And that's when that propaganda type um, behavior and systems were put in place on purpose through Jim Crow, which I call a terroristic apartheid system. But
Yeah.
that was put in place on purpose to keep a set group of people, and in this case, African Americans, in a situation where they could be exploited for gain. Whether that's through sharecropping, whether that's through low wages, whether that's through, redlining and keeping people in a certain, undeserved neighborhood. So
Yeah.
all of that rolled into that is what we're seeing the impact of. And then we're not even going to talk about how, healthcare for us, our healthcare was like when we were enslaved was, for two reasons, either for science, they were experimenting, doing all these
Yeah.
experiments on us to see what we could tolerate or what we could do, or for just, maintenance, like we were like chattel. We were considered chattel. So um, there's an epigenetic um, trauma
Yes.
that the descendants of slaves have carry, and it impacts health. It comes out as stress. It comes out and that morphs into obesity and diabetes and other chronic conditions. So and that's why I say it's so much to unpack because it's so huge.
Mhm.
And unfortunately, until our country takes the time to step back and say this is something that we need to address, this is not something you can keep sweeping under the rug. It's like a parasite. It grows legs and it just tends to take over things. And we're seeing the outcome of that now. It needs to be addressed in some kind of way, whether it's reparations or whatever. I know I'm getting all into another whole nother show and
But no,
conversation, but it's a lot.
it's so true. Like it is so true. And as you were talking, again, I don't know how I fall into these rabbit holes. Like you said, I fall into rabbit holes all the time. Ask my family. But I was listening to a medical professional in Barbados
Mm, mhm,
talking about exactly what you were saying, like the
mhm.
impact of slavery on modern day Barbadians,
Yeah.
right? And how they have the highest level of heart disease and diabetes. You know, I, I mean, just ridiculous. Like it exceeds the United States. But when you think about the trauma, when you think about the worst slavery happened in the Caribbean,
Yeah.
right? And so when the generational trauma that is carried forward, even when our generation and the next generation try to eat healthy and do right and do all these things, you're also combating genetics, right? Like you're also combating all of these things that are built into your DNA because of this trauma. And so I'm thinking of that. I'm thinking of, what you said about redlining and where um, certain communities are food deserts. They may not have a fresh grocery store or a grocery store that has fresh food
Mhm.
in it. They may not have access to doctors or readily accessible. And then again, generational trauma, there's this mistrust of
Yeah.
the medical field because of everything that has happened. And so it's just so much to unpack and try to unravel. But at the same time, what I think about is representation,
Mm.
right? Like when we see people that challenge some of those mindsets or show up. There was maybe about a year ago, there was
Mhm.
the artist that had started doing the drawings, the medical drawings, to
Oh, yes.
represent.
Hmm. Hmm.
I think the first one was like a black mother, right,
Yeah.
with child, right? And how that just kind of blew people's minds because they had never seen themselves even drawn in a medical book,
Yeah.
right? And so, you think about oh, my brain is just going in a million miles right now because I'm like, you think about that representation in that way, or even having black and brown doctors that understand and can connect with you because of that understanding of community. Right. So, are those some of the ways that we're starting to create equity? Like, Yeah, like where do you start? I know that was a whole lot.
So before I answer that, there's one point I want to share. I want to make.
Okay.
So when you're talking about that historic, representation and where we are, I think there is this um, sentiment on both sides that, okay, you're no longer a slave, right? So you have
Mm,
access to all these things.
that's
So you
questionable.
should
So
be
yeah,
progressing, right? Well, yeah, girl, that's another show too.
another show.
But
Yes.
it's this feeling that okay, you have access to everything now, right? And maybe this is a good what I'm about to say is a good display of what we're really talking about. But
Mhm.
we have access, right? Okay, so why aren't y'all doing well? You still got folks that are here and they're not doing well, and there's this crime, there's this and that. But if you think about this now, I don't know about your family lineage, but I can say on my family lineage, my mother grew up in Birmingham in the 1950s and 60s, right? So she grew up in Jim Crow era.
Yeah.
Um, Her mother grew up in what they call that black belt of Alabama near Montgomery. So my mother,
Hmm.
is the first generation to grow up off of the plantation. And I say that because not because my grandmother was a slave, but my grandmother was a sharecropper. My grandmother
Mm.
lived on land and, they made money off, well, they had their living on that land and they worked to earn their keep to stay on that land. My mother lived in that terroristic apartheid era, right?
Mhm.
So my generation, I am the first generation in my family, from my mother's side, to live outside of that. So
Mm.
that's something that I think that we don't think about because we
Yeah.
have this thing. Well, there's all this stuff. We should have access. We should have this, but we've spent more time in slavery and in apartheid than we have free. So that's something
Yeah.
that needs to be, considered. Um, so that's one. And then the second part is like, what do we do now as far as representation? These are starts. These are good things. Having representation in medical schools is so important. Starting from that beginning when our physicians are getting that initial medical training in anatomy and physiology. Yes, they need to see what does it look like. What does a rash look like on a dark skinned,
Right.
African American person? How does this present in whatever the skin condition is or whatever it is? We need those things and we need more. There's so much that needs to happen to progress, and I don't think this is not something that I think we're just going to snap out of
Right.
within the next 2 to 3 to 5 years. I mean, this is hundreds of years of undoing that we're trying to do. We're not only trying to get rid of the biases of the way people think and perceive African Americans and how that impacts the health that they're receiving and the treatment that they receive, but we're also trying to undo the systems that were put in place to exploit, um,
Yeah.
and that considered people like you and me less than. So there's a lot of undoing, and then there's also the undoing of our own mindsets
Mindset. Hmm.
that we have to do to know, wait a minute, I can use my voice. I can speak up for myself. I can, use my own agency to have the health care that I need, to
Yeah.
not only get the access, but have the conversations that I need to have with my physician, to ask the questions, not just take what they say as verbatim. So there's a lot of undoing that needs to happen. But the good thing is that when you look at change models and change management, we're in that unthawing phase. So we're unthawing some of the old ways of doing things. And
Mm.
then when we fully unthaw that, then we can start fully rebuilding to where we want to go.
Yeah. I'm just like blow it up, but then that's just me. So the other side of that, of what we're talking about is what I call going back to basics, right?
Mm,
So when I think about, though historically, you know, uh, Black people have been marginalized and harmed in so many ways, we were also very resourceful people.
Mhm.
And I think of a lot of the natural remedies, the things that, my mother, my mother will always say, like, oh, somebody was sick, granny would just go in a bush and come back and boil and do whatever. Like they knew exactly, they were so connected to the earth. And
Mhm.
so I'm also seeing this kind of reconnection back to that,
Mm.
a reconnection to apothecary, and a reconnection to herbalism, a reconnection to the earth, that is so innately who Black and brown people, and I'm not just going to say Black people, Black and brown people are,
Mhm.
right, of the earth,
Yeah.
which tends to be healthier, right, which tends to do that healing that many people need in a way that kind of starts to fix some of that DNA as well too, right?
Mhm.
Because there's that muscle memory in DNA. Um, and so I wonder how much of that is even being included in this, because I'm just going to throw out cannabis, right?
Mhm.
Of the earth, of the nature, but there are a whole lot of people in jail for it. And now a whole lot of people that aren't Black and brown
Yeah.
making money off of it. Right. And so,
Yeah.
and when you think of that industry, we're also the ones that aren't getting funding to do those types of
Mhm.
things.
Mhm.
So, when as I'm listening to you and I'm kind of going back and forth on, as people, we have this very innate way of connecting and reconnecting to the earth and doing the things that we need to do in order to heal ourselves. But the systems are in place
Yeah.
to also hinder that natural progression.
Mhm.
So, yeah, I'm trying not to feel disheartened.
Mhm. Well, no, so I have a couple of thoughts about
Okay.
that. One is a couple of things. So one, I think that attraction to nature, and natural remedies, I think that is also something that may be epigenetic. That's something that we carry, that our
Mhm.
ancestors had, that we lost. Like you said, mama and grandma would say, "Oh, I know, like
Go
my
out to the bush.
yeah,
Get some.
go put an onion around your neck." 'Cause, somebody would, what is that gonna do? And it
Right.
does something. I don't know how, but it does something. So, those little things. I think those are things that we lost because we lost our in a sense, we lost our sense of self. We don't know, I don't know if we've done any, genetic testing or whatever, but a lot of us, we don't know where we came from. We don't know our lineage. And so there's a lot of that stuff that we don't have. But now that we
Right.
have a little bit
Was it
more,
lost or was it stolen?
it was stolen.
Yeah.
It was stolen. It was robbed. It was
Yeah.
forcibly taken from us and hit and kept from us. And made to look bad so that when we tried to connect to who we were, it was like, oh no, 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 we can't have that.
That's the
Um,
devil. That's all these.
mhm, yeah, yeah. But I think there's a connection now. You have more people going back to their roots, embracing their natural beauty, embracing, making these, I know these trips back to Africa to
Mhm.
just see the land. So I think that has a lot to do with some of these things. And I don't know, I'm not very well versed in all the medicinal properties of, like, I know they've got mushrooms um and
They got
cannabis
everything.
and all this stuff now. But I mean, it worked in a generation. And a lot of the things that we're finding now, these synthetic medications, we're finding that there's some issues with them. Like, we've got this whole opioid epidemic that's morphing into this fentanyl. Who knows what'll be next? Because this fentanyl apparently is one little drop can kill you.
Yeah.
What else do we need to get high off of? So we need to come back to, what are these homeopathic things? And so when you said what, I guess, resources or what avenues are there that are exploring that, there are some, there have been in this presidential administration, there's been some changes. And I know that I think it's in some states, Medicare, Medicaid coverage will allow you to have food as medicine. And
Oh,
you can get, and I don't know if there's an age restriction or not, because I talked to my mom about it, and she went and got, oh, I can get this box of fruit for my, so she ordered this box of fruit. But
yes.
there's a company, and I don't know it off the top of my head, but you can order like fresh fruits and vegetables, and it's covered under your insurance. And so I think that's one way to kind of circumvent the whole, food desert situation,
Yeah.
and allow, some of those that can't go out and get the fruits or grow the fruits themselves and vegetables themselves to get that type of fresh nutrition. So there's some things out there that people can explore. You just have to find the right provider. So important to communicate with your provider, get them on your team.
Yeah. So I'm gonna do a little bit of a pivot.
Hmm.
Where were you? What
Uh-huh.
do you do to take care of yourself? Like, how do you fill your cup?
Oh,
As you took your sip, it was like, oh yeah, this is a good transition time.
okay, what do I do to fill my cup? A couple of ways. I'm a mom and a wife, and sometimes I need time by myself.
Mm,
Only
that part.
moms and wives will understand that. But sometimes I just need time by myself. And so I will take that time. And thankfully, I have a partner that allows me to do that. And sometimes that could look like me just sitting in my room, vegging out on Netflix while they go do something else. Or it could be me going away to a hotel or something for the weekend just so I can clear my mind. That's when I do my best writing, is when I'm alone. And then other times when I need to, self care with my family, together with my family. I love anything with a beach and
Mhm.
the water, the sun, anything like that. That just kind of rejuvenates me. We like to go to somewhere warm during the holiday season when it's cold here, and that just kind of gives me an extra bit of energy to keep going.
Speaking my language.
Um, yeah, so those are the things I do. I like solitude and I like family time.
I love it. Because there's a
Mhm.
lot of peace in what I'm hearing from you, right? Like just water's peace, solitude, there's peace.
Yeah,
And so, yeah, I appreciate that.
yeah.
So if people wanted to connect with you and learn more about the work you do and even, start to unpack some of the topics that we covered with health equity, how could they connect with you?
Sure. So there's two ways. If you're looking for assistance on an organizational level from your healthcare or hospital organization, reach out to me at info at Maria D. Flowers or mariadflowers.com. And I have a consulting firm and I do a lot of work on that side. I also have a nonprofit called Safer Healthcare for All. So you can go to saferhealthcareforall.com and get information about patient self advocacy. We empower the voice of the patient, and we have health equity town halls where we help provide and strengthen the community with the tools and resources they need so that they can do that.
Thank you. Thank you. Thank you for the work that you do. This is a topic around DEI that rarely kind of gets put in the spotlight. And so I'm glad we had this conversation because I think there were a couple of things that you mentioned that I don't think folks were even thinking about when they think about health equity and the systemic aspects of it. So thank you so much for being with us. And thank you all for listening and being a part of this week's episode. Tune in every Tuesday at 5:15 p.m. right here on YouTube or where you find your favorite podcast. And until next time, have a good one.